Kia ora tātou katoa, ko murihiku toku tūranga waiwai, ko hokanui toku maunga, ko mataura toku awa, kei te hiringa hauora o he mahi ana, ko Diana toku ingoa. No reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. Thank you very much for the introduction, and as yes, I'm very pleased to be here. As has been said, I grew up down this way and I went to the University of Otago, so yeah, I do love to come back down, and I'm staying with my mum at the moment out in Mossgiel, and the teenage children that were referred to, yes, they are lovely, and one of them is sitting an exam, history exam at 2 o'clock, so as 2 o'clock ticks over, if we could all just send some good history vibes, that would be great, thank you. She'll be mortified that I asked you for that. So today, I'm just happy to let you know about the work that we've been doing at the Health Promotion Agency in vaping over around about the last 18 months. We've been asked to do some work in the public awareness, national messaging space, so I'm going to let you know about that. And then at the end of the presentation, I also just wish to share with you a few of the tips and tricks and just some of the decisions that we made around the ways to communicate to people and the general public at large when we are talking about vaping within the context of quitting. So that's where we're headed with my presentation today. But firstly, just a little bit about Te Hiringa Hauora, the Health Promotion Agency where I work. We are a government organisation, we're a Crown agent, we're a similar type of organisation to DHB and the ACC, they're also Crown agents. So we're one step removed from the sort of the central hub of the government. The Ministry of Health is our monitoring agency, and they are a department. So just generally speaking, the Ministry of Health are the organisation that are involved in policy and in advising ministers, and the Health Promotion Agency is a Crown agent. We're more involved at the operational level and in terms of delivery. So we are separate organisations, but we work very closely with the Ministry of Health. A big part of our work, and I think the most visible part of our work, is our role in communicating national health messages, and a lot of that national health messaging, that work that we do, some examples up here, is at the it is at the direction and at the request that comes via the Ministry of Health. But we're also involved in sector support in a range of different issues, and some sector enabling activities. And you'll be familiar with some of our programs, I'm sure, as many of you work across health topics rather than just in the tobacco control space. So when it comes to vaping, what's our role been and what have we been asked to do? So at the end of last year, the Ministry of Health asked us to work on an initiative to increase public awareness of the role that vaping can play in helping people to stop smoking. And that was also in a cabinet paper released by the Minister. So we've worked very closely with the Ministry of Health over this whole period of time that we've been working on this, and thought long and hard and carefully with the Ministry about how to shape up the delivery of this expectation. When it comes to tobacco control, young Māori women are a real priority audience for the Ministry of Health, as we've heard this morning, and some of the other work that the Ministry have been doing. We saw presented here this morning from Te Riki Health. So this piece of work that we've done has been no exception. There is a real emphasis on that priority population of young Māori women in particular, and the reason for that, it's an equity issue, and Mihi spoke a little to that, but in New Zealand at the moment, our prevalence rate for smoking for all adults is sitting at 12.5%, whereas when we look at that narrower demographic of Māori women, they're still up at around about 33% in terms of prevalence for smoking. And those figures are relatively new. As Nivi mentioned earlier, the New Zealand Health Survey data, the most recent tranche of data, was released just last week. So if you haven't had a look into that, I recommend you do so. And Debbie, we could even potentially, send the link out with sort of follow-up email. Yeah, so 12.5% for all adults, but for Māori women, it's still around 33%. But it is coming down slowly. So as you know, this topic of vaping, it's been complicated for all of us. It's contentious. So really, early in the process, we sat down the ministry and with some other key stakeholders to really figure out what it is that we can all agree on and what is the common ground. And this, what we came up with here has really formed the frame of the work that we've subsequently done. And the top statement you'll see there is, the best thing that we can all be is both smoke-free and vape-free. That's the underlying premise of this work. We're all best off, obviously, breathing just clean, fresh air. The thing that's important there is that vaping can help some people quit smoking, and we know that. We're seeing that, clearly we're seeing a lot of that anecdotally, but also the evidence around the efficacy of the role that vaping can play in quitting is growing all the time. And in that statement that vaping can help some people quit smoking, that's really the justification for why there's any involvement whatsoever with vaping in the world of tobacco control. And the Ministry of Health have said that they really do see that it has a role to play in helping New Zealand get to smoke-free 2025. But there's really no hierarchy or weight placed on the statements that we have as our consensus and things that we agree on, but also you'll see clearly there throughout this whole piece of work we're really clear that vaping is not for non-smokers and it's not for children. And so for us doing this work, that meant we had to be really careful and nuanced in terms of our messaging and thinking all the time about avoiding any unintended consequences of communicating these the work around vaping, making sure that we didn't have unintended consequences as a result of what we were wanting to say to the public. So from the outset, thought long and hard about what we were aiming to do, and with the work and with raising people's awareness around vaping. And the top one there sort of sums it all up really. We were wanting to support smokers to make a switch to vaping, but the key thing is there and stop smoking completely. When people are both vaping and smoking, as Nivi said, that's called dual use. Sometimes we see dual use when people are making the transition. It's a normal and natural thing. Some people will just stop the tobacco immediately and switch to vaping fairly quickly. Others will dual use for a period of time, and that's an acknowledged and accepted way to make the change. But long-term dual use from a public health point of view is not helpful, and it's not the ultimate. We want to make sure that our smokers are making a full and absolute switch and stopping smoking and stopping the use of tobacco. Because if someone's even smoking one smoke a day, they're not an ex-smoker. They're still a smoker, and from a public health outcomes point of view, we need to see complete switches. And we really need to make sure that the support that we're giving to vapers and the information that we're giving is going to ensure that they're well supported in those first few weeks and they don't fail. They must succeed with their vaping, otherwise they will transition back to tobacco. Another thing that's really important here is that we were wanting to address some of the myths and misperceptions that had arisen in the public as vaping had not had a real public health framework put around it, and the vaping had been in the ether and in the media, and people had known about it for some time before there was a lot of public health messaging wrapped around it here in New Zealand, and so we know that people had developed beliefs and understandings about vaping that were not necessarily always grounded in evidence-based information. So we wanted to do some work to address that knowledge around vaping. We knew that New Zealanders were hungry for information around vaping when we set out on this journey. So it was probably more than a year ago now. We had our marketing team had a relationship with New Zealand staff at Google, and we had good information from Google around the searching that was being done for vaping related terms. And back then, and I'm sure it's higher now, but back then we were seeing around about 70,000 searches a month in New Zealand, people searching for vaping related information. So we wanted to make sure that those people that were searching online and looking for information were finding evidence-based and, importantly, New Zealand-centric information, rather than stuff that might be coming from overseas or industry and that sort of thing. So we wanted to help fill that gap when people are searching for information. So of the things that we've been doing, really two significant, visible, obvious things that you will see from the work that we've been doing. So the Vaping Facts website was the first big deliverable, and that has been delivered. So Vaping Facts, the website went live in June. I'll tell you a little bit more about that in a minute. But there was the new website, and then the second thing that we were to do was to deliver a national advertising campaign. And the campaign we were tasked to particularly have something that would engage with Māori women. So Vaping Facts, I hope many of you will now be familiar with Vaping Facts, and you will have seen Vaping Facts. Just got a brochure as well, we'll get going. So the Vaping Facts website went live in June, and to date, we've had around about 70,000, we'll be over 70,000 now. There's been 70,000 visitors to the website, and we're getting around 4,000 a week of new visitors to the website. We are promoting it. So what we're doing over the time that the website has been alive, we've been paying for Google AdWords. So when these people who are searching vaping related terms, when you're paying for Google AdWords, it makes sure that your URL comes up in their search results. So it ensures that you're sort of helping get your website into the results feed when people are searching for vaping information. So that those visitor figures are from promotion and pushing it out to people. So the website has three main parts. And I encourage you, if you have not had a look at it, I encourage you to go and explore and dip through and take a good look. But it's got key facts about vaping as one part, so it talks about what is vaping, talks about nicotine in vaping, talks about the risks and harms of vaping, and also a little bit about the current status of vaping in the law. And of course we're looking forward to when we can update that section of the website for when we get the Smoke-Free Amendment Act in. The other part of the website is about information on vaping versus smoking, so talking about the relative harms, talking about the differences in cost, so just making that comparison so people can see the differences and make up their own minds about the differences between vaping and smoking. And then the third section of the website, which is the useful starter place for those people who are wishing to vape to quit smoking, is all about essential tips for success, and it's a real sort of starter place. The website doesn't provide everybody with everything they want to know. It's a good starter place, and particularly for those that are wanting to vape to quit, they're not going to be able to rely on 100% on this website to take them through the journey, but this is the place that first and foremost this website lets them know that it's a legitimate and it's a valid option in their toolkit of all the things that are available to them to help them with their quit journey, vaping is an option for them. There are interactive and shareable elements of the website, so we've got videos. The quiz has been very popular. The quiz is a bit of a myth buster. It was an opportunity in a way to get people thinking about some of those things they might have heard about. And there's a cost calculator, so the quiz in particular has been really popular, and what we're finding are most people who start the quiz complete the quiz, and we're able to sort of keep an eye on the data, on the analytics of the website, and we are pleased with how it's performing. There's two brochures that sort of accompany the website, and these are like the super summary of the website, and the purpose of these is to push people to seek more information and to visit the website. So any of you can order these. We've got one in Te Reo Māori and the English version. These are able to be ordered from Health Ed for free, and they're also in many GP waiting rooms with the Mediboard service and in hospital waiting rooms. So they've been, the Mediboard people tell us that the uplift of these has been really high. So there is interest in people getting their heads around this information. That's the website. The second thing that we've been asked to do is the public information campaign. So the Vape to Quit campaign, there's a bit of a story behind the campaign. You haven't yet seen the campaign. The campaign is ready, but it hasn't yet, what we say, gone to market. So the original intention, we have a sort of an update on our work that goes out from time to time, and those of you who receive our update might remember that our original intention was for the campaign to be in market in October, but it has been delayed. The reason for that being that the legislative process, the amendment to the Smoke Free Environments Act, is, as with all legislative processes, it's always a bit of a guesswork in terms of when it's going to happen and when it's going to be introduced to the House and when the whole democratic process is going to start. So as we got closer to October, when this was to be live, it became apparent that it was going to, at that point, it was going to clash completely with the legislative process, and that was an uncomfortable situation for everybody. So in order to give that legislative process fresh air and to allow the democratic process to take its course, the campaign is not live, and our understanding is that it'll be able to be in market once that process of legislation is underway and moving along. So that's why you haven't seen it yet, but that is a still from one of the TV ads. So the campaign is, first and foremost, it's a quick campaign. When you see, well, when I saw, and my colleagues, when we saw the complete ads and have seen some of the content, the first impression is that it's a quit ad. It is a call to action for people to quit. And then vaping. So it's in your face, it's positive, quit ad. It's supportive, it's strengths-based. The people that you'll see in the campaign are all real people. They're not paid talent. We have positive stories of support from people who have whānau and family that have vaped to quit. So it's a little bit like what we heard from Tupulia earlier. It's about those stories of success, and it's about the voice of the people. So we're really pleased with the campaign, and we really hope that we're looking forward to seeing it when it's available. There will be ads on television, so probably most of you will see those. But these days, with the marketing channels that are available to us, there's a lot of modern channels for promotion that are really able to be quite carefully targeted to audiences. So Spotify and YouTube and things like that, unless you're in the audience, you potentially won't encounter the campaign. But yeah, it's going to have a mix of sort of national reach and also highly targeted placement. So that's the campaign and the website. And the thing I just wanted to also share with you is some of the things that we had to be very careful with and had to think about as we were preparing both the website and the campaign. And I can tell you that, you know, every word, every video, every nuance of the campaign collateral has been agonised over and been thought about and been argued about, and you know, it has been quite a challenging process for us to come up with something that we all felt very comfortable with. And the Ministry of Health obviously is a government organisation, and the Health Promotion Agency a government organisation, and we are, as Sally said right at the outset, you know, we have been as careful and cautious in this as we can, but also incredibly pragmatic and practical, and keeping our eye on the prize, which is about moving people away from tobacco. And we developed, initially this was a resource for ourselves in doing this work, and it's the foundation messaging. So we worked with the ministry to figure out what is the things that the government are comfortable saying to the public around vaping, and we call that our foundation messaging. And this is sort of the base information. And for example, the copywriter, the people that writing the copy for the website, you know, they take this and they can draw from it, and they know that, you know, working with this material, these are the things that we're comfortable communicating to the public. And we had to think really carefully about the language that we use for a number of reasons, and I'll just give you one example. And that we have to be careful in terms of the Medicines Act, because we have to make sure that we're not making any therapeutic claims about vaping, and we have to make sure we're not framing vaping as a medicine. And when it comes down to language, you've just got to be careful about how you articulate things. And there have been ways that we've been able to articulate things quite nicely without running into any issues with, you know, another piece of legislation. So if any of you are in the business of communicating to the public around vaping, if particularly in, you know, public health, you know, you're talking to patients, or you're a stop smoking service, you want to make a poster up to let people know that you're a vape friendly service, or that you will support people with vaping, we at the Health Promotion Agency are really happy to talk with you and share with you about some of the things to watch out for in terms of your communications with the public, things around language and things around imagery. Another language thing we've dealt with it is because the Te Reo Māori Vaping Facts brochure, my colleague Timothy Rangi, he worked really carefully and long and hard to think about what's the correct Te Reo Māori to use when we're talking about vaping. So he's an asset and a resource there who can, and he's really open and willing to have conversations if any of you are interested to explore that a little bit more. And we've got some commentary on that in this document as well. So we're happy to share this with you, and it'll be particularly useful, I think, if any of you are talking about vaping on websites, posters, brochures, or even just talking to patients. But I do emphasise this is not a handout for a patient, or it's not a handout for a public seminar or anything like that. This is for the health sector, and it is from this that you would draw from if you were making something for the public or for patients. Imagery, you might notice when you look around the website, we've got no pictures of vape devices, and there's several reasons for that. One reason is that vape devices are changing, a rapidly evolving technology. As soon as we would have an image, it would probably pretty soon be out of date. And we also are very careful not to be too aligned to any one provider of a vape device to another. We're really careful, there's no sort of implied endorsement or favour over one provider over another. So you won't see any pictures of vape devices. Another thing we've avoided, the fog. We don't have vapour creeping across the website or anything like that. For people who are smokers that wish to vape to quit, blowing big clouds and having a lot of vapour is usually not really a feature of their vaping. And there are negative sort of connotations around images of vapour and clouds and fog, and you know, there's that sort of vaping etiquette side of things. So those are sorts of images that we've kept well away from. If someone is vaping to quit, they're often using a really discreet device, and that, you know, they're not into blowing big clouds of fog and So we've kept away from that. And it's all just about the positioning and the sort of that wrapping that public health sort of framework around vaping. And just a note there that, I don't know, there is a resource, there is a sort of a guideline for those of you that are developing resources in the tobacco control space. We do have, or the Ministry of Health have, and it's available on our website, there is a guideline and a quality criteria that's worth having a look at. And we're happy to, if anyone is developing material and you want to have conversations with us, we're really happy for you to do that.